So earlobe placement is very important, but it's also difficult to manage. And when I'm suturing an earlobe in place, I think about how this earlobe is going to look 5–10 years down the line. So there are a lot of patients who 6 months after surgery, their earlobes look great, but then if you look at them 5 years later, they've got what's called a pixie ear deformity, where the lowest, most point of the earlobe is stretched down, and it looks almost like a V. So without giving away my secrets, there's a way that I suture it in place so that I can anticipate what the earlobe's going to look like in 6 months, and then also 5 years and 10 years down the line. You have to be, when you're working so hard on giving someone a result that's going to last 10 years and giving someone a result that looks natural, you don't want everything else to look natural and then have these telltale signs that they've had a facelift, such as a pixie ear deformity or a really wide scar. Or even the other thing that I really pay a lot of attention to is how the incision behind the ear heals. I was trained by a surgeon who is an expert in hair restoration also, so I learned techniques where when I make my incisions in the hairline, it's a hair sparing incision. So it's very important to me that the patient doesn't lose any hair during the surgical process, and that their incision doesn't look very obvious in the hairline. So those are all little things that it's important to pay attention to when you're trying to give a patient a very natural looking result.